Walking is quite likely the most neglected health habit currently in existence. I suggest it to every one of my patients. I realize that might appear to be a somewhat bold statement when we occupy a world focused on high-priced gym fees, strict protocols, Peloton bikes, complex supplement routines, and various other costly trends. However, the data regarding what consistent daily movement does for your physical frame is truly striking. You simply cannot overlook these findings. Most individuals have no idea how extensive these advantages actually are, stretching far beyond just burning a handful of extra calories during the day. I am Dr. Alex. I am an emergency medicine clinician with nearly 10 years of experience working throughout the NHS. My mission today is to help you avoid the advanced stage illnesses that I witness every single day and to share the wisdom I have gathered over the years. One thing I have observed repeatedly during my career is that there is a stark distinction between patients who can walk into a clinic room and those who find it a struggle to move. Those who continue to walk regularly as they get older tend to recover much more quickly. They face fewer medical setbacks, and they maintain their personal independence for a longer time. What the evidence shows us is that physical activity is one of the most reliable indicators of how well a person ages and how long they will live. Now, I am only 33, so you might assume this wouldn't really apply to me quite yet. However, we brought home a golden Labrador named Mango about a year ago. We adopted him as a very small puppy, and as his physical stamina grew as he aged, we found ourselves needing to walk him further and further every single day. We currently take him out 3 times daily, in the morning, the afternoon, and the evening. The shifts that I detected in my own health were truly impossible to ignore. My baseline cardiovascular fitness improved. My legs turned into noticeably stronger muscles because we reside in such a mountainous region. My mental state improved significantly. This was likely the most striking change I detected in myself, and my hunger patterns became much more consistent too. I am someone who constantly craves sugary snacks. So when I tell you that this scientific research is truly powerful, I am also noting that it aligns with what I have felt personally. In this video, I am going to guide you through 9 specific findings that consistently appear in the literature when individuals walk every single day. We will discuss your cardiovascular health, your kidneys, your liver, your joints, your musculature, and finally, your overall lifespan. At the end of the footage, I will provide a clear framework for actually doing all of this, because that is the segment most guides seem to overlook. Very quickly, before we move forward, only about 1/4 of you who view these guides have actually hit the subscribe button. So if you find these presentations helpful, then please consider joining the channel. It truly does help an immense amount. The first point, and the data here is as solid as it gets in lifestyle science, is that walking exerts a massive influence on your cardiovascular risk factors. There are numerous studies available, but a very extensive meta-analysis appearing in the European Journal of Preventive Cardiology combined data from more than 400,000 individuals and discovered that walking was linked with a major decrease in heart-related mortality. The correlation between the dose and the response was remarkably obvious, meaning that higher step counts were tied to a lower risk profile, with the advantages starting to level off somewhere between 7,000 and 10,000 steps daily for heart-specific outcomes. What is taking place biologically is that steady walking enhances your endothelial function, which refers to the status of the delicate inner lining of your blood vessels. I mention this frequently. It seems to be in almost every presentation now. What that actually does is decrease the rigidity of your arteries. It enhances your resting blood pressure levels. It balances your cholesterol profile and minimizes body-wide inflammation. All of these factors are unique cardiovascular risks that walking manages simultaneously. The Major Nurses Health Study, which monitored more than 72,000 women over a span of 8 years, discovered that those who walked at a brisk pace for at least 3 hours weekly had a 35% lower risk of suffering a heart attack compared to sedentary individuals. That is a massive drop for an intervention as basic as walking. Point number 2 focuses entirely on your blood pressure. This topic requires its own focus because hypertension, high blood pressure, is among the most frequent conditions we encounter in the emergency department every day. I would estimate that likely more than half of the individuals I treat have a systolic blood pressure exceeding 140. That is entering quite hazardous territory. The reason it matters so much is that it quietly ruins your blood vessels over several years and serves as a primary cause of strokes, heart attacks, and renal disease. Consistent walking has a very significant impact on this. A massive study appearing in the Journal of Hypertension analyzed these walking programs across various groups and found average drops of about 3 to 4 points in the systolic, the top number. While that might not sound huge, on a population scale, a 3-point drop in average systolic pressure is linked with huge reductions in the frequency of strokes and heart disease. For people with stage 1 hypertension, below 140 systolic, that kind of lifestyle shift can be enough to avoid pharmaceutical intervention or at least push it off for several years. Point number 3 is that your regulation of blood sugar improves drastically. Every time you move, your contracting leg muscles absorb glucose from the blood through a metabolic path that is largely separate from insulin. You do not require your insulin to be functioning perfectly for this mechanism to work. The muscle action itself pulls glucose into the cells, meaning that walking shortly after eating is one of the most effective ways to flatten the post-meal sugar spike that would normally occur. A study featured in Diabetes Care discovered that taking 3 15-minute walks following meals lowered 24-hour glucose levels more effectively than one 45-minute walk taken at a different time of day. Timing really is key here, and we suggest this strategy to our patients all the time. For individuals who are insulin-resistant, pre-diabetic, or managing type 2 diabetes, which represents roughly 40% of viewers, this is a significant discovery. It is a powerful tool that is free of charge and has 0 negative side effects. Keeping mealtime glucose low means lower insulin, less damage to vessel walls, and a meaningful reduction in chronic disease drivers over time. Number 4 addresses your renal health. Based on what I have seen, many of you are very focused on the status of your kidneys, which is excellent. Let's look at this topic specifically. A large study monitored over 6,000 individuals with chronic kidney disease and found that regular walkers had a much lower risk of seeing their condition progress toward failure compared to those who were inactive, even when accounting for other vital factors. There are several different paths involved here. We know that steady walking lowers your blood pressure, which directly eases the filtration stress inside the glomeruli, those tiny cleaning units in your kidneys. Reducing that pressure slows down the pace of organ damage over the years. Walking also boosts your insulin sensitivity and manages your blood sugar, which are primary drivers of kidney harm, and it dampens systemic inflammation. While some of these advantages are indirect, coming from blood sugar and pressure improvements, they are very real and have been verified repeatedly. Point number 5 focuses on your liver this time. Non-alcoholic fatty liver disease is one of the most prevalent liver issues in modern society. It likely impacts roughly 25 to 30% of adults. Most individuals who have it are completely unaware. It happens when fat buildup occurs in liver cells, initially showing no symptoms, but potentially moving toward inflammation, internal scarring, and eventual pain. Over time, it can lead to cirrhosis and total organ failure. One of the most effective ways to treat it, proven by many years of data, is regular aerobic activity like walking. A systematic review in the Journal of Hepatology discovered that exercise routines, including walking at a moderate pace, significantly lowered liver fat even when the subjects did not lose significant weight. That is a vital point. The benefits to the liver are not just about weight loss. The movement itself has a direct metabolic influence on how the organ processes fats. Number 6 is that your joint status actually gets better, despite common misconceptions. Most people believe that walking might ruin your joints, specifically the knees, and that you should rest if you have arthritis. The evidence suggests the complete opposite. Cartilage is the shock-absorbing tissue in your joints. It lacks its own blood vessels, so it relies entirely on the fluid within the joint for nutrition. That fluid only moves when the joint is active. When joints sit still, they turn rigid, they are poorly nourished, and they are more prone to breaking down. A large long-term study known as the Osteoarthritis Initiative monitored thousands of people and discovered that regular walkers faced less pain and had better function over time. Walking also strengthens the surrounding muscles like the glutes, hips, and quads. Stronger muscles around a joint act like shock absorbers, which eases the direct pressure on the joint and protects it from wear. Let's discuss musculature specifically now for number 7. As we age, we naturally shed muscle tissue, a process called sarcopenia. This is a primary reason people turn frail, suffer falls, and lose their independence as seniors. To be perfectly honest, walking is not the same as lifting weights. If you truly want to build new muscle, you have to do more than just stroll. However, for maintaining the muscle you currently have, staying coordinated, and slowing down age-related loss, regular walking makes a huge difference. An article in the American Journal of Clinical Nutrition found that those who walked more daily retained significantly more lean muscle over 4 years. Part of this is metabolic. Walking helps you use insulin better, which protects muscle. Additionally, keeping your legs active keeps the brain-to-muscle connection sharp, which is essential for balance and preventing stumbles as you get older. Point number 8 is a very significant one. We know that walking drastically enhances your mental wellness and cognitive capacity. The data here is remarkably consistent. It minimizes depression, lowers anxiety, boosts your mood, and decreases your stress markers. These are not minor shifts. A massive report in the British Journal of Sports Medicine found clear drops in depression scores from walking across many different populations. Part of this is chemical. Walking initiates the release of endorphins and endocannabinoids, the brain's natural mood enhancers, and it lowers cortisol, your primary stress hormone. It also boosts BDNF, brain-derived neurotrophic factor, which acts like a fertilizer for your neural cells. It helps existing neurons stay alive and encourages new growth. Higher BDNF is tied to superior memory, clearer thinking, and a lower risk of dementia. The long-running Framingham Heart Study discovered that active individuals had much lower rates of dementia over time. Number 9 is essentially the sum of all parts. You live longer when you combine these advantages. Superior heart health, managed blood pressure, better liver and kidney function, protected joints, maintained muscle, and a healthier mind. This cumulative effect on your lifespan is enormous. A study featured in JOMA Internal Medicine tracked nearly 5,000 senior women and discovered that those moving roughly 7,500 steps daily had much lower mortality from all causes compared to those only getting 2,500. The advantages seem to level out around 7,500, which is an important detail. You don't have to reach 15,000 or 20,000 steps a day. Getting to 7,500 is very achievable for the majority of people. So there you have it. 9 things that improve when you move every day. I truly hope I have shown you how influential this habit is. And now I want to provide a framework for implementation. Knowing walking is healthy doesn't automatically mean you will do it. Most health guides don't give you anything practical. Here is how I would start if I weren't already walking. First, identify your baseline. How many steps are you currently getting? There is a high chance your phone is tracking this. Check your daily average from last week and use that as your start. If you don't have that data, get a cheap fitness watch. You can find one on Amazon for less than $20 or $30. Once you have that baseline, use it as your foundation. If you are getting under 3,000 steps, your only goal for the next 14 days is to add a single 10 to 15-minute stroll per day. Starting small and scaling the habit slowly is what the evidence supports. After 2 weeks, that single walk will feel like a normal part of your routine. At that point, you add a second walk. The best timing, due to the blood sugar reasons I mentioned, is after you eat. Even just 10 minutes helps manage your glucose. The ultimate target for most is roughly 7,500 to 8,000 daily steps. This will vary by age, size, and your terrain, but that 7,500 powered mark provides immense benefits. Regarding speed, move briskly enough that you can still talk easily, but you'd find it hard to sing. You want to be slightly out of breath but not panting so hard that you couldn't chat with a companion. This is the ideal zone for metabolic and heart health. The last and most vital point is consistency. A single walk doesn't change much, but 6 weeks of daily effort does. Make it as easy as possible to show up. Choose a favorite time, a nice route, and a partner if it helps. If you can, get a Labrador. Honestly, Mango was the best thing we ever did for our family's health.